human anatomy is very variable, and it's always quite surprising to see what you think was one thing is another, and you can confirm for sure under ultrasound guidance. So why use ultrasound in orthopedics? So why use ultrasound in orthopedics? Two reasons. One is for diagnosis. It's safe, it's non-invasive, there's no radiation, and you can use it at point of care in real time with a dynamic exam. So you can watch things moving in real time. Additionally, for MSK injections, you are quite a bit more accurate than blind injections. Don't forget, if you want more about the business of orthobiologics, I have a podcast, or you can go on my website, the business of Orthobiologics, and tune in. Even in intra-articular knee injections, it's 89% accuracy versus 98% accuracy. And you can pinpoint the pathology with differential injections. And what I've found through the years is human anatomy is very variable. And it's always quite surprising to see what you think was one thing is another. And you can confirm for sure under ultrasound guidance. So ultrasound shows the soft tissue interfaces between the different densities or impedance, and there's a sound wave reflection that produces an echo. And that sound wave is perpendicular to the surface of an object being imaged, and that will be reflected more than if it's not perpendicular, it may bounce off. So additionally, sound waves can be absorbed depending on the density, or refracted, meaning that it bounces off at odd angle. So absorption of the sound wave is enhanced with increasing the frequency of the transducer, as well as the tissue viscosity will help increase the absorption of the sound wave. So when we talk about ultrasound frequency, the transducers are designated by the range of sound wave frequencies it produces, and that is described in megahertz. So the higher the frequency, the higher the resolution or clarity or granularity of the image, but that is at the expense of the sound beam penetration due to the sound wave absorption. And so the higher the frequency, the more clear you can see it, but the depth is not going to be as accessible. With the low frequency transducers, you are able to assess those deeper structures, but at the expense of resolution. You have a lower resolution picture. So these are our probes. We have a linear probe in the 12 megahertz, a curvilinear probe at the 9 megahertz, and then a compact linear used for very small structures that you don't need depth at the 15 megahertz. So it'll improve the quality of the picture. So these are our ultrasound textbook references. Please, if you're wanting more guidelines, the AIUM guidelines is a great guideline. The ESSR is also a great guideline to be able to go ahead and look online, and they can kind of run through all of that ultrasound examination. And then don't forget, if you want more about the business of orthobiologics, I have a podcast, or you can go on my website, the business of Orthobiologics, and tune in. Otherwise, thanks so much. We'll see you next time.